Hi, this is Dr. Brian Heaberlin here with Lexington Ear, Nose, and Throat and Allergy, and I wanted to discuss a common problem that we see in the office, and that's tinnitus or tinnitus. That's a term that refers to a sound that we hear in our head or ears that really isn't there. The common description of that sound is a ringing or roaring sound, typically a high-pitched constant tone, but it can be pulsatile, it can come and go, even when it's that high pitch when it's present. If it's in one ear or if it's pulsatile, often that dictates a more thorough workup. Sometimes pulsatile tinnitus can be related to blood vessels or blood vessel related tumors. One-sided tinnitus can also be related to a type of other benign tumor on the hearing or balance nerve. And so workups for those two issues are often needed. For bilateral or tinnitus that you hear in both ears, that's most commonly related to hearing loss. Many times that hearing loss is high frequency, and sometimes it's so high frequency that patients don't even realize that they have a hearing loss, that is. The tinnitus can be mild and not really bother people much, or it can be very distressing to the patients. Anytime the patients are uncomfortable, so if they have chronic pain or anxiety, often the tinnitus perception is going to be much louder. We are a little limited on the therapies that we have for tinnitus. The most common things we recommend is what we call tinnitus masking. That's where we just have other sounds around to make the tinnitus less noticeable. Often it's worse when people are trying to sleep, so having a sound machine or even just a fan on at night can be helpful in making people not hear the tinnitus because there's other external sounds around. Hearing aids can be helpful for it. There's also medical therapies that are used in some cases, although it's not the most common thing that we do. There are a lot of herbal or supplemental medicines that are out there, and really there's no good proof that any of those things work. It's something that's probably not harmful to try, but there's really not strong science or really any science behind many of these things. It's a super common problem that affects about 1 out of every 6 Americans. So there's like 50 million people in the United States with this problem. Because it's so common and our physician-related therapies are limited, there's a lot of things that I'm not sure how effective they are on the internet and on various websites. So just patients should be a little cautious when looking into different therapies and just know that they may not be something that works, and it may be a method for people to try to take advantage of patients that have a difficult problem. A good reputable website is the American Tinnitus Association, and that's ata.org, who has a lot of great information about tinnitus and some ways to help deal with that. People that have tinnitus that's bothersome should have a workup by a physician, and that's typically going to include a good hearing test by an audiologist. We're looking for things that are treatable. If there's hearing loss present and we treat the hearing loss, many times the tinnitus can get better and go away. If there are unilateral tinnitus or pulsatile tinnitus, again, that necessitates a workup looking for different types of problems that could be more serious. Well, thank you. I appreciate your time.